right, next we're going to have a look at what is called long-acting reversible contraception. So these are the options that we refer to as kind of the set and forget options. And there's a lot more push nowadays for women to consider using LARCs, long-acting reversible contraception, because they are so easy and so reliable. So this little device here, this is called the Implanon, or some people call it the rod or the stick. So basically it's this 4 centimetre long little piece of plastic that gets inserted into the arm. So we give you a local anaesthetic and just numb that area and then pop that in, and 3 years it stays in there for, and it's really effective. This is the most effective form of contraception that you can have, and it's actually 99.95% effective typically, because once it's in, you can't forget, you don't have to do anything, it's just there. So it's a great form of contraception. So when you think about LARCs, I always say to women, if you don't want to have a pregnancy in the next few years, really think about having a LARC, a long-acting reversible contraception, because it just takes all the stress away. So now we're going to have a look at what we call intrauterine devices. So there's a couple of different options. This one here is called a Marina. So basically it's a little device, and it is quite small. I'll just show it to you on my hand. And it gets inserted through the vagina, through the cervix, up into the uterus. I'll show you on here. So it sits in the uterus like that. Yep. And you still ovulate with it. It changes the lining of the uterus so that if a sperm does travel up there and meets an egg, it can't actually embed into the uterus. So hormonally, a lot of women like this because they still ovulate every month, and but it can reduce your periods as well. So it's also can be really quite useful if you've got heavy and painful periods, because it can change that. Now this one lasts for 5 years and it's 99.8% effective. So great option. You can get it done in a chair in the rooms. So you don't have to go to hospital and have a general anaesthetic, but you can, if you want to, you can get referred to the hospital if you'd prefer to go to sleep and have one put in. And yeah, it lasts for 5 years. Then there is another smaller one, a new one that's come out. It's called Kyleena. It also lasts for 5 years. I don't have one to show you because they've only been out just recently. It's a bit smaller, so a younger woman might prefer to have that as an option, but it doesn't manage heavy periods or painful periods like the Marina does. And then the other option is the copper IUD, which I can't find. Oh, here it is, sorry. So this is the copper IUD, this little device here. Looks a bit scary, but same as the other one, it's only little. And basically when it's being inserted, these little arms fold down as it's being popped in, and then they open up inside. And it's got copper twisted around it, and it's the copper that actually, it kills sperm. So go figure, I don't know who worked that out, but it means you're not using any hormones. So a lot of women like the idea of having a form of contraception that'll prevent an unplanned pregnancy without having other hormones in their body. So it's not good for women though who have heavy and painful periods. All right, so its effectiveness is 99.2%. This little one here lasts for 5 years. There is another copper IUD that you can get. I don't have one to show, but it lasts for 10 years. So yeah, great options. There's lots of options out there. I also just want to tell you about, there's also the emergency contraception. Some people refer to it as the morning after pill, but we try to change that thinking because you don't have to take it the morning after. You can take it up to 5 days, 4 to 5 days after you've had unprotected sex. The sooner you take it, the better it is. And there's a couple of different tablets that are available. So one tablet you can take up to 4 days afterwards, and it's more readily available. The small chemists stock that. You don't need a script. You can go into the chemist and just ask for emergency contraception. Or if you don't feel comfortable doing that, you can go to your doctor and get a script. Or you can come in and see us, and sometimes we have a supply as well that we can help people out with. There's another type of emergency contraception tablet that lasts up to 5 days. It's not as easy to get, but you could certainly ask at the chemist if they've got it. But again, the sooner you take it, the better. Yeah. And it kind of, it works, it depends on, you can't really say how effective it is, but it does only start in the 80s. 80% effective. It depends where you're at on your cycle and whether you've already ovulated or not as to how effective they are. But they're definitely worth trying. We don't try to advocate that it's a form of contraception. It's really an emergency contraception. So it's a backup plan if you weren't planning to have unprotected sex, or you had a broken condom, or it slipped off, or you had sex and weren't planning to, so you didn't have a condom, or you realised afterwards that maybe you've missed some pills in this month and there is a risk that you could get pregnant, then always go and get some emergency contraception to try. You can also use the copper IUD as a form of emergency contraception. It's really effective, but the tricky thing is finding someone who can put it in within 5 days, because it does need to be inserted within 5 days. Okay, so there's lots of different types of contraception out there now. So hopefully that's just given you a bit of an insight on the different choices that are available. And if there's anything that you would like some more information about, feel free to make an appointment to see either one of the nurses at Bendigo Community Health or with one of the doctors. And yeah, have a great day, everyone. Okay, bye.